Good morning, HFD. It is Dr. Schulz, MD5, with another update on the COVID-19 situation. It is just after 11 o'clock on Thursday night, so that would be April 2nd, to get you guys just a reference in terms of numbers. I've heard lots of feedback that it's helpful to kind of hear where we are in the grand scheme of things in the numbers. So we'll start there. Then we'll go on to some recommendations in terms of station life and how to help prevent spread of the virus. So first of all, we had a milestone today. It's not a milestone you really want to hit, but 1 million cases. 1 million cases worldwide. And the number as of just a little while ago was 1,015,403, but 1 million cases worldwide as of April 2nd, with about 53,000 deaths, which is terrible. At the same time, there were over 210,000 patients who are actively recovered and well. Not still under treatment. I'm talking like done. So, there's a light at the end of the tunnel for a lot of these patients. Here in the United States, 245,000 cases is our number, with just under 6,000 deaths. But remember, we are at a point now in the United States where testing is still limited. And so therefore, we don't have widespread testing like other countries have. So we don't have all the positives that we would normally, we'd be looking for. So, though you have to take some of these numbers with a grain of salt. Texas, we are number 12 in the states in terms of ranking the states for cases. We have 5,100 cases, 5,100 and a couple. And we've had 81 deaths here in Texas. And here in Harris County, we are just shy of 1,000 cases. We are 955 cases. I expect we'll break 1,000 tomorrow or the next day, certainly by Monday. And we've had 10 deaths, unfortunately, here in Harris County. And so those are the numbers. That's kind of where we stand right now. As many of you know, some of those Harris County cases have been firefighters. We have more than one firefighter who's tested positive. We have multiple firefighters who are out sick, either pending testing or have tested positive. And one of the things we need to understand is that while absolutely the runs you make, the patients you see are a risk. That's why we stress our PPE so much, right? If you wear the proper PPE, it's really important to wear the proper PPE because it's going to protect you from an exposure on a patient care scene. But the other place we have to think a lot about exposure is at the fire station, right? In the household family exposure is a very high risk for exposure. And the fire station is a home, right? Y'all look at it that way. It's a second home. It's a place where y'all live, you eat, you sleep. You are a family at the fire station, and therefore you're at risk of transmitting it. Right? If someone were to pick it up off duty, pick it up from a patient, doesn't matter. Once you bring that back to the fire station, you're at risk of transmitting it to other people. So there are, and I'll be honest with you, as of right now, of the firefighters who are quarantined, a large percentage of that are people who are quarantined due to exposure from another firefighter who ended up testing positive. So that's one of these things that we have to be really careful at not bringing this to the fire station. And step one is don't come to work sick. I know I've said it in videos before. I know it's been stressed. Guilty as charged. I've gone to work sick before. I think most people watching this video have, but you can't come to work sick right now, because if you have COVID-19, if you have this disease and you spread it among your brothers and sisters at the fire station, you're only hurting them. You're already sick, but you're only spreading it to them and hurting them and their families. So be really careful. If you're sick, if you're under the weather, you need to not come to work sick, okay? It's really, really important. That being said, there's more and more data coming out. And I know I've talked about data, and I've told you guys this is a fluid situation that keeps changing. And it's changed, right? We used to think there was minimal asymptomatic patients. Now it looks like the number's larger. 20 to 25% of people who have COVID-19 positive may be asymptomatic. Now, remember, and I've said this before, the spread is not driven by asymptomatic people. Asymptomatic people shed a whole lot less virus that could then contaminate and infect someone else than someone who is symptomatic. So we still think we know this pandemic is driven by symptomatic spread. But asymptomatic spread potentially does exist, and asymptomatic positives do exist. So that's why it's so important you follow the guidelines that come with taking care of, preventing the spread. And this is not HFD specific guidelines. This is the stuff that the mayor and the news is all saying on the 6 o'clock news. Right? Social distancing. You've heard it. We've talked about it. Right? We're trying to flatten the curve, all that good stuff. At the end of the day, if you can spend as much, keep as much space between you and other people, especially, in the fire station, in those settings where you're normally pretty relaxed, you're going to actually help minimize the spread of this virus. Okay, it's generally described as a droplet-driven virus. It's a droplet precautions. And other than a forceful cough or sneeze where you actually have a piece of saliva projectile out of the mouth, 6 feet is this kind of magic bubble we talk about, that medical IDLH, that magic place that where you're really at a risk. So if you continue to maintain a significant distance from other people, right? And it's not always easy, right? Certainly the dorms are hard to do that if it's possible at all. But does everyone need to sit shoulder to shoulder at the dinner table, right? That's part of the culture. It's part of the camaraderie. It's part of the firehouse life. I get it. But right now, it's something that may need to go on hold temporarily till we get through this thing. Because sitting shoulder to shoulder, you're certainly inside that 6-foot bubble. And if you are asymptomatic but potentially going to develop symptoms tomorrow, you could potentially spread it to your colleagues, or they could spread it to you, right? Hand washing. As simple as it sounds, wash your hands. Soap and water, okay? It's better than the hand sanitizer. It's better than pause wipes. Those all work, don't get me wrong. But soap and water is the best thing you can do. So wash your hands often, clean the station, decon the station. And then while we're on your hands, don't touch your face, right? This virus is not going to go through your skin. It's going to get in through a mucous membrane. And the most common one is through your mouth and your eyes, right? Your nose as well, more with a breathing thing. But in terms of I touch something that is contaminated, I touch my mouth, or I, lick my fingers after eating something, or whatever it may be, or I rub my eyes. Those are all things that can spread that virus that I touched on a surface and spread them into my body. It gets into the mucous membranes. Okay, so try not to touch your face. Hygiene, stay really clean, kind of keep the place really clean. If you think you've had a bad exposure, you feel like you got coughed on or else, changing uniforms, taking a shower. We're going to talk about, actually, I'm going to be working with Hazmat this weekend to produce a bunch of videos on decon and how to kind of protect yourself further in terms of uniforms and showering and all those kind of things. But, so you'll see those next week. But just the overall thing, the overall theme of keep the station clean, basic hand hygiene, don't touch your face, and maintain that social distance is going to help prevent that spread, right? Nobody wants to see anyone in the fire department get this disease. I really don't want to see you spread it to one of your brothers or sister firefighters, okay? And the way you do that is to maintain a lot of these kind of really simple techniques, right? If it means social distancing a little bit, whether it be where you sit on the couch to watch TV, or like some guys sit up at the table where they're more spread apart, people hanging out in the bay, whatever it is, keeping that social distance is going to really help. Maintaining that hygiene, the hand washing is going to help. And we want to try and flatten the curve and slow this spread down such that, on the public level, you've heard me talk about this, public level, we want to flatten the curve to protect the hospital system. But on an HFD level, within our department, we need to flatten the curve because we need to be able to keep putting butts in the seats on the apparatus, right? if everybody gets sick and everybody goes home, we still need to provide service. We're still here to do a job, every one of us, and we're here to take care of the citizens of Houston. And we need to make sure that, we protect ourselves, because I don't want to see any of y'all sick. I don't want to see any of y'all come into the hospital. And at the same time, I also don't want to see any citizens suffer because we couldn't provide the best possible care and the best possible response to their emergency. So that's all I got today. Hope you guys have a great shift and stay safe out there. And I'll talk to y'all soon.